to forecast symptoms a person can get years after getting the infection. And here with us now to discuss these new findings is Dr. Hiral Tipirneni. She's an emergency medicine physician. Doctor, thank you so much and welcome back to BNC. Let's talk about this. Is developing a test to detect the long-term effects of COVID-19 plausible?
Well, thank you for having me. It's a pleasure to be here again. And, right now we have very limited research on this, but it is incredibly important area of research. And so if we are able to devise a clear indicator in the early stages of knowing who is more vulnerable to long COVID, I think that would be tremendously helpful in long-term care. And right now, the study that you're mentioning specifically looked at levels of antibodies, specifically two immunoglobulins, IgM and IgG3, and those were lower in those folks who had long COVID in the initial stages than those folks who didn't. But remember also that this study did not differentiate between vaccinated and unvaccinated. So there are other aspects of this kind of research that we need to, delve into deeper before we really know if we have a comprehensive test that can truly predict long COVID. We also know that there are other
Okay,
factors
so
that are involved in. Oh, I was just going to say that there are other factors involved that make long COVID more likely, like having a higher, an elevated age, being in middle age, but also having other comorbid factors, other risk factors like asthma or other chronic illnesses. So all of that should be taken into account in the nature of the study.
Doctor, thanks. I appreciate you adding that. I actually did want to ask you more about the virus because, of course, we're learning more and more about this as we go on. Long-term COVID, how do you know that that's what you have? What if you had COVID and then later on down the road you experience some sort of symptom? Couldn't it just be that you have something else, and possibly maybe you have an allergy, or maybe you did develop some sort of issue that has nothing to do with COVID? How are we able to differentiate between having these suffering from something that may or may not be long-term COVID?
That's a great question. And it's really important that folks who do think that they may have it seek medical care and actually get input from their primary care physicians, because it's important to make sure they're not, of course, like you said, missing some other entity that might be treatable or might require other intervention. It usually means that they have the symptoms sustained for a month or longer. Folks are presenting with all sorts of symptoms, some of them neurologic, some of them more constitutional, like just chronic weakness and fatigue. The neurologic can be, disorientation, lack of focus, memory, and concentration issues. So there are a lot of areas that it can be impacting. And that's why it's really important that if anybody does suspect that they have long COVID, to not just blow it off and think, well, this is not treatable or this will just fade in time, but to make sure that you do get evaluated by your physician to ensure that it's not some other process that possibly requires other intervention or treatment. And also just to make sure that they can monitor you to see how these symptoms proceed and offer you other adjunctive therapies that might be helpful in alleviating these symptoms. We want to make sure that we are
Right.
not just attributing it to something that we can't do anything about, because we can certainly make those folks' symptoms somewhat more, easy to live with and to cope with.
Doctor, while we're talking about other health issues, I want to talk about a new study that shows that some children can overcome peanut allergies by eating peanut protein powder in early childhood. What do you know about this?
Yeah, this is an exciting study. I personally know several families who have children with peanut allergies, so this is welcome news. It's not anything fully definite yet, so I want to put out that bit of caution there. It's in the Lancet, but it's an exciting piece of research. And basically, the study had 146, I believe it was, youngsters between the ages of 1 and 3, and they were fed these small amounts of the ground peanut flour versus a group that had placebo. And the findings are exciting. They showed that 70% of the children who received the actual peanut flour, excuse me, did show that they had a reduced immune response to an actual amount of peanut protein later on. So it showed that their immune system was what we call desensitized to that peanut protein. It was not mounting that severe immune or allergic reaction. It was instead tolerating it just like the folks who don't have allergies. And it in fact showed that almost 1/5 of the children who went in that arm of the study achieved full remission. So they were able to fully desensitize their immune system to the peanut protein, and they were able to then consume peanut butter and peanut products without any issues. So it is very exciting. Again, this is not 100% definitive. It is a small study by any standards. It's 146 children, but it is exciting, and it shows us that there is potential to desensitize your immune system to those things that trigger the immune response that is so pathognomonic of hypersensitivity reactions such as peanut allergies. And imagine children not having to worry about having their EpiPens and not having to avoid peanut butter and jelly sandwiches or all the snacks that have peanut protein in them. It would be incredibly freeing for a lot of children, and a lot of parents could breathe a sigh of relief if and when this completely pans out.
Yeah, that is so exciting. We always love to give good news on the health front, even if it's just a tiny bit, because, like you said, we want these kids to be safe and we want them to have their peanut butter and jelly sandwiches. Doctor, thank you
That's
so much
right.
for joining us. Good to see you. Take